a fairly substantial increased risk for sudden death.
I quit breathing during the night.
The problem is they simply stop breathing.
I have sleep apnea.
I didn't know what I had. I just knew I was tired.
And in fact, about 20 million Americans have it. Only about 1.5 million are treated for it. Most of it goes underdiagnosed. Apnea is a Latin word for lack of breathing, and sleep apnea essentially is lack of breathing at night while you're asleep.
Sleep apnea is a condition in which, though it's normal for one's muscles to relax when they go to sleep, the muscles in this part of the pharynx will actually get a little too relaxed, and they'll relax enough that they'll literally cave in and partially block off the airflow.
When you lay down and you go to sleep, the muscles that maintain the upper airway, for example, you have muscles that hold your tongue forward, muscles that hold your throat out to the side, and so forth, they relax and that airway starts to come together. And initially that just creates some resistance to airflow, which is manifested as snoring. But it doesn't take a whole lot to go the next step past that, where you have a complete blockage of the air.
If not enough air get into the lungs, then the oxygen level in the blood can fall. That increases their risk for heart attack, stroke, and sudden death due to the low oxygen level depriving the heart, brain, otherwise of oxygen.
There's 3 types of sleep apnea. One is obstructive apnea, the second type is central sleep apnea, and the third is mixed apnea.
More than 90% of all apnea is obstructive sleep apnea. And what happens is that as you go to sleep and you drift into deeper sleep, and those muscles relax, you develop snoring and then an obstruction. You remain asleep, but your body is trying to breathe against an obstructed airway.
Keep in mind that obstructive sleep apnea, these individuals might appear to you as though they stop breathing, but that's not what's really happening. They're actually continuing to try to breathe. We can watch their diaphragm move, we can watch their chest move. They're just not getting the air through because the airway's blocked off.
If you're looking at somebody doing this, usually they'll be heavily snoring and then they'll go silent. And then as they arouse back to a lighter stage of sleep and start to move, you might hear snorting and gasping, and they start breathing again.
He used to snore really loud. Even when the kids were around, they'd say, "Is that Pop snoring?"
Typically it's described like snoring like a grizzly bear or a freight train. It typically drives the bed partner out of the room at night. So it's significant snoring. Also, you're going to observe periods of pauses in the breathing. So typically it's a cyclical pattern of snoring followed by pauses of breathing, and then followed by what we call a resuscitation snort. So they snort and sort of restart the breathing cycle again.
He would quit breathing altogether, and then he'd start up snoring again. And sometimes it was so long that I'd walk over and shake him to see if he was really going to breathe again.
And what that is, when you come up to a lighter stage of sleep, it's a micro-awakening. And what that results in is literally hundreds of mini awakenings, and sometimes even complete awakenings throughout the night.
My doctor told me for every 60 minutes, you're awake 29.
So the next day, you've been sleep deprived, especially of the deeper stages of sleep. So, you know, that's obstructive sleep apnea.
Second type of apnea is central apnea, where the brain is not sending signals for breathing to occur.
In essential apnea, the problem is they simply stop breathing. There's no effort to breathe. There is a problem centrally, and that's what central means in the brain, in which the signal is not sent out. So there is no effort on the patient's part, either with their chest or their diaphragm or otherwise, to even attempt to breathe.
It's seen in conditions like brain diseases, heart failure, strokes, so forth, and that's actually pretty rare.
And it's a very specific finding, pretty much restricted to individuals either with congestive heart failure or with brain injuries.
Mixed apnea is a combination of the two.
In the mixed apnea, there's this short period where they'll actually stop for a few seconds, and then as they start to resume breathing, the obstruction takes over and they don't get air through.
Your oxygen may be dropping, your carbon dioxide may be elevating, and eventually your brain goes, hey, I've got to breathe here, I'm not moving any air.
There are some misconceptions in that regard. Many people think that this is an obesity-related syndrome, and though weight contributes, it's probably not the underlying cause. This is probably a muscle phenomenon in which, for some reason, the pharyngeal muscles are a little too lax once the individual achieves sleep. Obesity contributes, but it contributes in sleep apnea like it contributes to lots of other disorders. If one has a tendency to diabetes, as you gain weight, the diabetes may get worse.
It turns out that the older you get, as you get up in age and you have laxity of those muscles, after a certain point, it doesn't really matter how heavy you are. You're just almost as likely to have it if you're thin. And there's also typically a male predominance, but after menopause, unless you're on hormone replacement therapy, women are just about as likely to get it as men are.
We think it runs in families, but it's not genetic as in blue eyes. That is, it isn't passed from one to the next to the next.
There tends to be an increased incidence in families. That may be related to several factors. One, environmental factors, because people may have the similar diets and may be overweight in a family, but there are also families where people are thin and have sleep apnea, and this may be related to the structure of the airway. So they may have intrinsically a more narrow airway that has a predisposition to collapse.
Now, what people need to know is what are the signs and symptoms that I may be having it.
Well, the main signs of sleep apnea is typically loud snoring during sleep, and that's typically what brings the patient in, typically more common in men, so the wife may be bringing the husband in for loud snoring.
My wife said, Bob, there's something wrong with you. You need to find out what it is. You're falling asleep all the time.
My husband told me that I was snoring when I was sleeping and I was waking up and jiggling around too much at night.
The other cardinal symptoms of sleep apnea would be excessive daytime sleepiness during sleep, and then witnessed periods of stopping breathing during sleep for up to 10, 20 seconds at a time.
I was falling asleep driving. I was falling asleep in church. I would fall asleep talking to people.
She insisted that I snored, and I quit breathing during the night, and she went to all the trouble to see to that my doctor knew this, and he tested me.
There's two main consequences of untreated sleep apnea, and you can divide them pretty much into two groups. One is just the sleep quality.
So they get a poor quality sleep, and typically these patients will feel tired, fatigued, their cognitive functions will be impaired.
So there's the sleep quality and energy aspect. Then the other main consequence is the cardiovascular, blood pressure, heart failure. It's a risk factor for heart failure, heart attack, stroke, and they're finding actually a whole host of, there's almost not an organ system that's not involved with sleep.
Well, sleep apnea can have severe health consequences. Most significantly, it can lead to hypertension or high blood pressure, heart disease such as heart failure, heart attacks, arrhythmias, sudden death during sleep, and stroke.
And there are other things that you might never consider. For example, people with sleep apnea have over 6 times as many fatal car accidents and motor vehicle accidents as the rest of the population.
There is a fairly substantial increased risk for heart attack, stroke, rhythm problems of the heart, those types of things, and sudden death.
If you have heavy snoring and you're excessively sleepy, or you have heavy snoring and you have one of the other associated features like high blood pressure with heavy snoring, heart failure with heavy snoring, if you've had a mini stroke or something, then you definitely need to be evaluated for obstructive sleep apnea.
So typically how obstructive sleep apnea is found is the patient will complain of excessive daytime sleepiness, morning headaches. Their wife tells them they snore extremely loudly and they better go to the doctor and get this treated. So they'll go to their family doctor, possibly a specialist, and talk about their excessive daytime sleepiness.
I would have probably never done anything about it had my wife not said, you know, Bob, there's something wrong with you.
He didn't think I was sleeping right, so he told me that I should really go get tested to see, because he believed that I had the sleep apnea.
The physician at that point would send the patient to a sleep lab.
To provide us an opportunity to evaluate the patient and then put them in a situation where we can monitor their sleep.
Well, they called me and had set up a time for me to go, and told me to bring my pajamas and to bring a pillow so I would be comfortable. And I went to the hospital where they have a special unit just for sleep apnea.
At the sleep lab, what occurs is your first night that you're there, they hook you up with all this equipment. And you have what's called a baseline study, your first night.
They hook up all these wires to your head and to your face and to your body and to your chest and your legs. And then they say, okay, go to sleep now. Oh, right. That's not easy.
All these wires monitor the various functions that occur while you're asleep. So the wires on your head will monitor your EEG, which is your brain waves, and you're also on a video camera and an audio receiver at all times, so that even though the room is dark, we have an infrared camera that allows us to monitor you with both audio and video during the entire time. When an individual goes to sleep, what we'll do is typically monitor them initially, and we can determine pretty quickly usually whether or not they have obstruction to their airflow if it's significant.
If it's found that you have sleep apnea, which is the most common sleep disorder, you will come back for a second night. And during that night, they will actually use a CPAP device or a BiPAP device and do what's called a titration night. And basically what they're looking to find the best pressure or the lowest pressure that they can find that will keep your airway splinted open.
Well, with CPAP therapy, when they get an initial diagnostic test and then they're titrated to CPAP, we actually determine which pressure is effective.
CPAP, which stands for continuous positive airway pressure, is a mask that people wear overnight. It interfaces